Hey, come to the operating room with me for one day, because you're not going to see anywhere else in the world where mental health can so heavily impact your physical health than when you're unconscious under anesthesia. That's right, because even when you have a breathing tube in place and you can't even talk to us, your body keeps score, and you can tell the score when you're under anesthesia. Welcome to one of the most secretive and stressful places in the world. Why? Because even if you've been here before, in the most stressful and scary moments of your life, you probably don't even remember it. Hey, from San Francisco, California. Before we go in the operating room, I wanted to just talk about how anxiety can be healthy to a certain extent. Once it goes beyond that, though, it can be harmful. You're in a new environment in the operating room, and your body gets primed for action. All systems have to be online in case something happens. And just this past week, I had a few patients that were totally in the harmful zone. So one morning, I got up at 5 a.m., got the OR ready by 6:30, and the surgeon's there, the nurses are there. Everyone's there, but the patient never showed up. Turns out afterwards that they were so anxious, they just didn't show up to the operating room. And they're going to have to live for the next weeks or months in pain for the reason they were going to have surgery if they're ever ready to even have surgery again. In another case, I had a patient that fell asleep and then had a severe asthma attack and some other anesthesia complications when they were asleep, and they woke up with incredible pain in addition to those complications. Afterwards, they told me that they had so much anxiety before the surgery that they actually were using marijuana before they came into the operating room. Those complications and the marijuana use are probably linked. Oh, and here's Karma, by the way, here to say hi. I had another patient who, after we fell asleep, they had serious heart complications to the point where I had to actually cancel their surgery and wake them up before the surgery even started. I learned afterwards that they had such severe anxiety, such severe chronic pain, that they self-medicated with meth. And they're not going to have surgery again for weeks, if not months, until their body totally clears that meth, and they get rescheduled again if they're even still a candidate for surgery. So let's head back to the operating room now, where we can talk about how anxiety reveals itself under anesthesia, even if you're intubated and can't talk to us and tell us you're anxious, and also learn about how you can naturally that's Karma back there. But how you can actually naturally get your anxiety under control and maybe even heal yourself through the surgery experience. See you in there. So there are lots of reasons for patients to have anxiety before they come in the operating room. In fact, fear or anxiety around general anesthesia alone causes about 1 in 4 patients, it's like 25%, to cancel or postpone elective surgery. You might be anxious for other reasons, like the reason you're having surgery in the first place, whether it be cancer. Maybe you're anxious or afraid of the IV placement, the nerve block, the epidural, or the spinal. Maybe you're concerned or anxious about how you're going to recover from the surgery, the pain you may have after, maybe the loss of the body part that you're going in for surgery for, like if you're a woman who's going to have their uterus taken out. These are all things that can increase anxiety in patients before surgery and can increase the risk of certain complications. That's right, your preoperative anxiety state has a huge impact on your body during, and more importantly, after your surgery. Things like increased pain, or a transition from acute pain to chronic pain, meaning that you have pain for even a long time after your surgery is over. It can be depression after surgery. It can be more nausea after surgery because you had higher anesthesia requirements because you were more anxious. Or maybe you used certain substances to help self-medicate. Or maybe you used perfectly safe pharmaceutical medications, but they all still have an effect on your brain, right? They cross the blood-brain barrier, and our anesthetics totally interact with those. So anxiety can have all these effects on your body. But there's an upshot too, because a certain amount of anxiety can actually be helpful. You probably never knew that though. Did you know that anxiety kind of follows a curve like this, where there's a maximum or optimal level where that amount of anxiety may actually improve your wound healing? Why do we care about wound healing and your immune function? Surgical site infections are major complications from any surgery. So anything that we can do to help improve your immune function may help reduce the risk of postoperative infections. Your wound healing also depends on your immune system. Your immune system is totally in charge of helping you heal and recover from the surgical incisions and the cuts and everything else that happened to your body while you were unconscious under anesthesia. And you know why that matters? Not only because of the cosmetic effects of the scarring, but also because the longer it takes your wounds to heal, the longer you're going to be in pain. The faster your wounds heal, the less pain you're going to have overall. There's also another more mysterious part about how anxiety can actually help us heal. And that's how anxiety may help us have a transformative healing moment, even in the deepest, darkest moments of our life. Because when you come in the operating room, you probably will feel some anxiety because you may have never been here before. Humans are primed to have more anxiety when they're in new or novel environments. It's like a defense mechanism, right? You want all your systems online because you're in a new place. You haven't been here before. That can be a wake-up call, in addition to whatever reason you're having surgery for. Maybe it's for heart disease. Maybe it's for cancer. But for whatever number of reasons, that can be a wake-up call for you to reevaluate your life and your health. And you have anesthesia on board. Powerful psychoactive medications that cross your blood-brain barrier. I've done a video on this in the past, so check that out, where we actually talk about this mysterious inner healing potential in the operating room before surgery or even under anesthesia during surgery. If you want some examples, look at patients who wake up and quit smoking cold turkey after their surgery. Look at women who have cesarean sections, like major abdominal surgery, with a spinal but without a drop of IV anesthesia to help calm their nerves. Now that's powerful because the more medication you get for cesarean sections, like full-on general anesthesia, can increase the risk of postpartum depression. The more IV agents you get, the greater the chance of some of those medications crossing the placental barrier and crossing the fetus's blood-brain barrier, potentially leading to complications after the baby's born, like respiratory depression. Maybe they'll need a little baby breathing tube for a little bit of time. This is all to show that while anxiety has impacts on your brain can also affect anxiety. You have incredible power to take control of your anxiety. Sure, we can give you IV medications like benzodiazepines, like midazolam, also called Versed, to chemically chill you out. But what about patients who are concerned about waking up delirious, like waking up kicking or screaming or crying? Or maybe elderly patients who are worried about post-operative cognitive deficits, like waking up maybe with memory problems after surgery. We don't know all the reasons for some of these complications, but they can be serious. And if we have safe alternatives to avoid the potentially culprit medications, isn't it worth discussing that with patients before surgery? It's what I do with my patients every day because I call them before their surgery so that we can discuss the different anesthesia options and to begin to prepare them for a potentially healing experience in the operating room. So what are some of those natural therapies to reduce your anxiety before surgery? I'll give you a couple. The first and maybe the most powerful and easy is breath work. Because you see, after we give you the anesthesia medications, you stop breathing. That's why we need to place breathing tubes like this one here to support your breathing after you fall asleep. For a couple of minutes, you may not be breathing. That's why we need to place an oxygen mask to help build up the oxygen in your lungs so you have an oxygen reserve for those critical couple of minutes. There's two ways you can breathe. One is an anxiety, terrified, panic breathing. The other one is a relaxing breath. In my experience, patients that fall asleep more anxious, more fearful, are more likely to wake up with those similar emotions, only intensified because they have anesthesia on board that disinhibits the frontal cortex. Things like kicking, screaming, crying, etc. I've talked about the breathwork before in other videos, so you can check that out, but you have a brief moment there where you can use some powerful breathing techniques to help calm your whole body, change your heart rate variability, etc., before you fall asleep, hopefully gently and peacefully. Another example is aromatherapy. Typically very safe, but always talk to your doctors and surgeons before you do any supplements before surgery. Lavender is a good example of a powerful aromatherapy agent that can help reduce your anxiety before surgery. Another powerful example is meditation and mindset work. Earlier I was telling you how women can give birth with a cesarean section without a drop of anesthesia. Incredible, right? There are many reasons for why women can do this. One reason is because they've had 9 months to make a commitment to a type of surgery, to make commitment to delivering a baby. They may have had anxieties that go into that, and they also have a clear-cut goal, and they've had months to shape that vision. On top of that, you can have physical activity integrated with meditative practice. Things like yoga, tai chi, qigong, and the benefit of the mindful component as well as the physical activity component. And the cool thing is that you can take all these with you, even after your surgery, as you discover your innate healing potential to conquer your anxiety, to get ahead of it, to hopefully live your life with fewer medications afterwards. Thanks for watching. I hope you learned something. If you did, be sure to follow and share with your loved ones. And leave comments below and let me know what other secrets you want to know about the human body so that you can control your inner healing potential.